afternoon. My name is Callie Douglas, and I'm a student nurse at the University of Southern Mississippi, and I'm going to be taking care of you today. Can I go ahead and get you to identify and verify your name and date of birth for me, please? Okay, it matches your wristband. And do you have any allergies? No, you don't. All right, so today your physician has ordered for us to put in an NG tube and administer some medication for you. So basically the NG tube is going to go through your nose into your stomach so you can get some nutrition and medication so you can hold it down, okay? Okay, so I'm going to go ahead and raise the lid and look at the patient. Okay, so I'm going to perform proper hand hygiene and put on my gloves. I'm also going to verify my order, make sure this is the right patient and they do have an order for the NG tube. So first I'm going to take the NG tube and measure it out, see how long and how far we need to insert it, making sure not to touch any other surfaces. So I'm going to measure from the tip of the nose to the earlobe, and then from the earlobe to the xiphoid process, which will be down here. So that is at the first hash mark, the first black line. So I'm going to go ahead and lube the tip of the tube 2 to 4 inches. Make it more comfortable for the patient. And now I'm going to ask the patient to tilt his head back and swallow as I insert it gently, and then once it hits the pharynx, I'm going to ask him to tilt his head forward and continue to swallow. And at any point, if he experiences coughing or cyanosis or choking, then we will discontinue the insertion. I'm going to look at which nostril is appropriate, which one's more open. For me, it is the left one. So I'm going to go ahead and say, ask the patient, please tilt your head back and swallow for me, and start inserting it. And then once it hits the pharynx, I'm going to ask the patient to tilt their head down. We're going to go, continue to swallow, and now we are at the first hash mark. So I'm going to go ahead and grab my piece of tape and secure it onto the patient. So it is now secured onto the patient, and we would go ahead and get a chest x-ray to make sure the NG tube is in place and is in the stomach. We could also aspirate some gastric juices if it is, and test the pH and see if it is the acidity as the stomach acid would be. And the x-ray came back and it is in the stomach, so we're going to go ahead and start to administer the medication that the physician has ordered. So we're going to do our 3 med checks before we drop the medication and as we drop the medication. And we're going to do our 5 right. So right patient, right drug, right dose, right route, right reason, and right time. And so all of that is checked out. It's the right patient, it's the right dose, right medication, everything's great. So we're going to go ahead and pull it out. We'll put some normal saline solution into here. We're going to go ahead and flush it first. So we drop, I think it's 30 milliliters of solution. We flush. All right. And then we take the medication, we drop some more solution, and we add the solution to the medication and crush it up so it becomes more of a liquid-like consistency. We drop the medication, and we also push that. And then lastly, we'll go ahead and drop some more saline, and we'll flush. So flush, medication, flush. And then that is how you administer medication with an NG tube. And if the doctor ordered to have the tube removed, essentially we'd verify the order, make sure everything's correct, and then we would unloop the tape from the tube as well as from the nose. We'd go ahead and begin to remove it. Now, if the patient complained at any point of, they were coughing or they were experiencing cyanosis, choking, then we would discontinue the removal and call their physician. So once we are done with that, we get the patient cleaned up. We make sure there's no irritation around the nose. We get rid of the adhesive of the tape, give them some water, wet their mouth and things like that. We ask the patient, do you need anything else, sir? Is there anything I can do? Are you experiencing any pain? Just questions to make sure that they're comfortable and they're comfortable sitting here. They're not in any pain or experiencing any discomfort. And so we'll just make sure they're comfortable, lower the bed back, and give them their call light, as well as make sure both of the side rails are up. And then we do hand hygiene after making sure that our patient is comfortable, they have their call light, and they're in a safe position. Do hand hygiene, and that is the end of it.